My name is Carleen Hawn. I'm the co-founder and CEO of a company called Healthspottr. We are a national network for health innovators and investors, and our mission is to identify entrepreneurs who have new tools or services that can aid in the transformation of healthcare. We try to identify the best examples of successful innovation and then draw out of those case studies, if you will, lessons that can be applied by entrepreneurs or other readers of the Foundation's website. So we began the process of researching the paper by trying to identify large institutions in healthcare that have been particularly successful with identifying innovations and then scaling them across large systems. The 4 institutions that we chose to profile for the paper are Kaiser Permanente, which is based here in the Bay Area, the Center for Connected Health, which is a division of Partners Healthcare in Boston, the Mayo Clinic, and Ascension Health, which is a large Catholic hospital system based in St. Louis, Missouri. One of the things that we found is that each of these institutions has a unique process that they use to identify innovations and then scale them. There are many lessons to be learned in each case, but some of the highlights might include Kaiser Permanente, which has a very inward-looking focus in terms of identifying ideas that could be most helpful to its hospital system. They rely very heavily on their own staff and have systems in place that are meant to encourage even low-level employees to share creative ideas that might, at some point evolve into a new software tool that can help nurses on a maternity ward, for example. Partners Healthcare has a strategy that is external in many ways. One of the things that they've found that works very well for them is to commercialize innovations that have great potential. And the case study that we focus on with regard to the Center for Connected Health is an example of an innovation that was developed internally and then spun out and commercialized on the open market. Ascension Healthcare of St. Louis has a mixed strategy. They definitely rely on internal creativity, internal sources of creativity in their own staff, but they have a very developed set of processes of funding innovation projects or innovation centers, like small incubators, in cities across their national footprint. Mayo uses an 8-point test to vet every single idea that comes before their business development office. It's very succinct, it's really clear, and it's something that we think any entrepreneur or investor could review or use in their own attempt to decide which ideas are worth pursuing. And it's highlighted in the white paper.